Hi, my name is Victoria and I'm a student pharmacist. I am here to present over Miss Angelina. She is a 37-year-old African American female. She's here today complaining of fever, cough, and fatigue over the last 5 days. She also has a cough with sputum production. She's experiencing shortness of air and myalgia with increasing in severity. She is unable to fulfill her duties of a coach over her daughter's soccer team, so she's came in to see her primary provider. She does state that she has asthma and seasonal allergies, but they are well controlled. Her past medical history includes hypertension and asthma. Her asthma does seem to be moderate but persistent and seasonal allergies. Her family history is not important to this case. Her social history includes being employed as a social worker. This is important for insurance reasons. She does deny smoking. She does agree to having 4 glasses of wine about a week, denies illicit drug use. She is not currently pregnant nor breastfeeding, and she does live with 2 children. She does have allergies to some medications, penicillin, where she experiences diarrhea. She does have an allergy to latex, where she experiences a rash. Her home medications include calcium carbonate or Tums. It's 1 gram chewable by mouth BID, atenolol 50 milligrams by mouth QD, a prenatal multivitamin she takes once by mouth daily. She does use a ProAir or an albuterol 90 microgram inhaler, 2 puffs by mouth as needed every 6 hours. She does use a Brio inhaler, fluticasone bilateral, the 100 milligrams combo, 1 puff by mouth daily. She also uses a fluticasone or Flonase nasal spray, 1 spray into each nostril daily. She does state that she is adherent to home medications. Her immunizations include being up to date on all of her childhood vaccines. She has received the flu vaccine in October of this flu season. She has received the pneumonia vaccine 12 years ago. She has completed her Pfizer COVID-19 series as well as a booster within the last 6 weeks. A review of systems include being positive for chills, fatigue, fever, and just general body pains. She is positive for congestion, negative for ear discharge, pain, and sore throat. She is positive for a cough and sputum production, as well as shortness of breath. She is negative for wheezing and respiratory, though. For cardiovascular, she is positive for chest pain, negative for any palpitations. As far as GI, she is negative for any abdominal pain, nausea, vomiting, or diarrhea. And for musculoskeletal, she does have the myalgias, and she is negative for a skin rash. She's also negative for dizziness and headache. For her physical exam, pulmonary, she had normal breath sounds, no wheezing, no rales. She does have tenderness to palpation. Her skin has no rashes, red patches, or pale color. Cardiovascular, all within normal limits as far as MRGs and RRR. Forgot what that means. As far as vitals, her blood pressure was 128 over 72 millimeters per mercury. Her heart rate was 83 beats per minute. Her temperature was, she does have a temperature today of 101. Respirations, it's 16 breaths per minute. Her height is 70 inches. Her weight is 150 pounds. That does put her BMI at 21.6 kilograms per meters squared. This BMI also puts her into the healthy category for the BMI categories. Her labs that were collected, her serum creatinine is 0.9. She does have an elevated white blood cell count at 13,000. All other lab values in the basal metabolic panel was within normal limits. She did have negative results to the adenovirus, flu PCR, and COVID-19 PCR. And her urine HCG levels were undetectable, indicating negative pregnancy. Her creatinine clearance was calculated to be 92 milliliters per minute. And diagnostic testing, the chest x-ray that was ordered revealed consolidation with small pleural effusions in the lower right lobe. Her left lung was free and clear. So her problem today is lower right lobe cap, community-acquired pneumonia in a non-severe degree. Evidence of this is found with the patient being febrile, she's fatigued, cough with a sputum production, shortness of air or breath, and myalgias for the last 5 days with increasing severity. She has a white blood cell count of 13,000, which is elevated. The chest x-ray indicates pneumonia of the right lower lung. The patient has a CURB 65 score of 0, indicating an outpatient by mouth PO treatment regimen. Based on the 2019 ATS and IDSA diagnosis and treatment of adults with CAP guideline, the patient has a comorbidity of asthma and could receive a combo therapy with a beta-lactam and macrolide, or a beta-lactam with a tetracycline, or monotherapy of a respiratory fluoroquinolone. The goal for this problem is to eradicate bacterial infection, return vitals of temperature back to normal, and lower the white blood cell count. Let's see. The recommended drug regimen is going to be levofloxacin, 750 milligrams by mouth once daily, or QD, for 5 days. As far as safety and toxicity, for safety, we're going to want to watch for QT prolongations, tendinitis, and sensitivities with the black box warning. Toxicities, we're going to look for nausea, vomiting, and diarrhea. We're going to monitor the patient's serum creatinine and BUN levels and ratios. As far as efficacy, we're going to make sure this patient can reach an afebrile temperature and decrease her white blood cell count. Thank you. Are there any questions for me? Thank you.